Yep.
Yes.
That's a yes.
Absolutely.
Agree.
Yes. Yes.
All right. I think we're all set, Dr. Gaither.
Okay, perfect. Let's go ahead and call the meeting to order. Thanks everybody for being here today, and these what are busy times for everybody. We appreciate your participation. Let's start with roll call, please. Shelley, can you do the roll call?
All right. Amber Prince.
Present.
Candace Williams.
Here.
Carrie Lewis. Corbin King.
Can you hear me?
Dale Woolridge. Danielle Stello. Danielle Stello is here. Garth Gamer. Heather Miller.
Heather Miller's here.
Thank you. James Cicilline. James Cunningham.
Present.
Joshua Gaither. Julie Augenstein. Laura Smith. I saw her on the chat. Melissa Moyer. Michelle Guadagnola.
Present.
Pam Nolan. Pam Goslar. Paul Dabrowski. I see James Cicilline chiming in there. Paul Dabrowski. Ralph Kelly. Ray Proa.
Present.
Rebecca Harrow.
Present.
Sean Boker.
Present.
Tiffany Streever. And Tom Flanagan.
Here.
Count 13. We do have quorum.
Excellent. Thank you, Shelley. Let's start then with a few announcements. For housekeeping things, we have all been on a lot of meetings, I am sure, but reminders on how the Google Meet works. If you hover your mouse over the bottom of your screen, you do show the buttons to mute and stop your video or speak show up. So hover over the bottom to mute yourself or speak. If you are attending by phone, to speak, please press *6. Please be advised, Shelley did make the announcement. However, be advised this meeting is being recorded. Anything on your video or that you put in the chat will be available for the public. Shelley and Julia will be monitoring the chat box for questions. I will do my best to also monitor that. And again, for everyone's benefit, please do identify yourself before speaking. Not everybody has a name on the screen when you pop up. And again, please be patient with all of us today. I know I am having some issues with internet connectivity, so please forgive me if I do cut out for a moment. Those are the housekeeping items. Let's turn our attention to the chairman's report then. Pretty straightforward. If you all want to click on the attachment that says attendance report, The attendance report you can all review. A friendly reminder that if you miss 2 consecutive meetings, the Bureau will contact you, ask if you're still interested in serving on the committee. We currently have no new members. We will be discussing some bylaw changes later on the agenda. There are 2 vacancies currently, pre-hospital EMS coordinator representing NAMES and pre-hospital EMS coordinator representing AIMS. Again, we'll talk about those a little bit later. That's it for the chairman's report and vacancy report. Let's go ahead and turn it over to the Bureau. I believe first up is Julia with a report for EMS for Children. Julia?
Good morning, everybody. The only information today I have for you is that the National EMS data collection is starting up again in January. So it will be the same survey that went out earlier this year from January through March. And so I'll be sending out some materials soon, but the survey again starts in January. That's all I have.
Hey, this is Tiffany Straver. I just want to let you guys know I was on the phone.
Thank you.
And I apologize. It may be my internet or it may be Julia's. Julia, did you finish? I couldn't hear you.
I'm sorry. Yes, I did finish my report.
Okay. Thank you very much, Julia. Let's move on then to opiate and cardiac arrest data.
Thanks, Julia. I'm gonna present a tab here real quick. As soon as this pops up. So we have gotten quite a bit of interest, appropriately so, in during the March to October period about COVID-related cardiac arrests and opioid, and we have some preliminary data that we are ready to share. So this current screen shows suspected opioid incidents from January to September. The rate per 100,000 has increased. So I don't think this is particularly shocking to our public safety stakeholders that opioid use has increased over the course of the summer and during the pandemic. I think there are some pretty reasonable theories about people being home and having access to opioids, as well as a lack of support. So that's something we're continuing to track, and we will continue to present some of this data. And then the other data that has been of significant interest is the rate of cardiac arrests during the pandemic period. So we have trended that with 3 years of data from January to July. Obviously, July was the pretty substantial increase in cases, and the rate per 100,000 increased pretty dramatically in July of 2020 for cardiac arrest cases, as well as pronounced on scene that were not transported. So these 2 graphs are kind of our preliminary information about this. We are continuing to monitor it. What I can say is, because the cardiac arrest graph ends in July, it has since come back down. It is still higher than the previous 2 years, but it is not quite as dramatic as it has been in July. And so that's something we're continuing to watch, and we'll present probably at the next meetings in January. And that's all I have for those 2.
Thank you, Ben. Again, I apologize. My internet is poor. I think next up is the regulatory and bureau chief update.
Good morning. Can you guys hear me okay?
Yes.
Hopefully that's a yes. All right, perfect. Always want to do a mic check when we start talking. Well, I just wanted to say a big thank you and welcome to everyone being here this morning. I know remote meetings are not the easiest, but we have a great attendance. It looks like 58 people so far. So we really appreciate everyone participating in these meetings remotely. I know everyone has been wondering what was going to go on with the bureau chief position after Terry has left us. And so I just wanted to welcome Rachel Garcia today. This is her first week, so she started just in time for all the standing committee meetings, so she's going to quickly put on her mic, and I just wanted to make sure I introduced her.
All right, good morning. I hope you all can hear me. I'm attempting to use my camera this morning and my mask as well, but good morning, Dr. Gaither and all. I'm happy to be here. Big shoes to fill with Terry's departure, but very happy to be here. I want to thank you all for your patience as I transition into this bureau chief role. I'm currently still supporting our ETOC COVID-19 response. So doing a little bit of double duty, and thank you so much for your patience as I transition and wear a couple different hats. I have just a really brief update on our COVID response to date. Right now, I think many of you know our numbers are increasing. We currently are considered a moderate spread statewide with over 287,000 confirmed cases reported as of today. We do have the key benchmarks that we are tracking to that are currently suggesting substantial spread statewide, although there are differences observed by region and county. We are keeping a close eye on our hospital and healthcare metrics. As of this morning, our hospitals report ICU and med-surg bed capacity at 89%. So we're working closely with our hospitals to make sure that we are on top of any staffing needs that they are reporting on a daily basis. Yesterday, Governor Ducey and Dr. Tara Christ held a press conference, and they did go over some of the strategies that the state is working on with the Department of Health Services. Yesterday, they did announce that there are some new safety guidelines recommended for having a safe Thanksgiving. I know we're all looking forward to Thanksgiving next week. There were also announcements made about testing resources for airports, as well as ensuring masking on school grounds. There was also an announcement about an executive order issued yesterday with an enhanced surveillance advisory on immunization reporting for providers moving forward. The EMS Bureau is also working to renew the administrative order with EMS rule waivers. So that existing rule waiver order, we expect will be renewed moving forward for another 90 days. We will do our best to keep everyone posted on the progress on that. And with that, if there are any questions, I'm happy to help answer. But that's the briefing I have before I turn it over for an additional Bureau update.
Thank you very much for the information, and certainly. Oh. Sorry, Dr. Bradley.
Go ahead. Oh, no worries. Thank you. No, I was just going to say thank you and welcome. We're really excited to have Rachel here with us and starting this week in time for the committee meetings. Really no other regulatory updates. Just a reminder that we are still going through the rule writing process with several of the Article 9 rules. So as those meetings become scheduled, you should get notification. We have tried to make sure they are really widely advertised by the Gov delivery system, also to the regional councils. And if you are on Ruth Ann's mailing list, you will definitely get it from her. So you may get multiple announcements about those meetings, but we definitely make sure they are well publicized. And that is it for the Bureau. Thank you, Josh.
Okay, thank you all and welcome. Let's move on to our discussion and action items. Can I please have a motion to discuss, amend and approve the meeting minutes from July 16th of 2020?
I make a motion to accept the minutes, Raymond Braw.
Second.
And I'm sorry, I didn't catch the name of whoever that was on the phone that seconded.
Gamer.
Thank you, Dr. Gamer. Please take a moment to review the meeting minutes. Do we have any requests to amend those before we call for a vote to approve? Okay. Hearing no request for an amendment, I'd like to call for a vote to approve the meeting minutes as they stand. All in favor, say aye.
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 Say nay. Thank you. Hearing none opposed, the motion passes and will approve the meeting minutes from July 16th without any amendments. Next, let's move on to discuss, amend, and approve the bylaws and updated roster roles. If I can, I'd like to ask that one of the Bureau's staff members please take us through the proposed changes on the bylaws before, I guess first we do need a motion to discuss. I apologize. Can I have a motion to discuss the bylaws?
Candace Williams, so moves.
Thank you, Candace.
Ray
A
Parker.
second? Thank you, Ray. So let's move on then. Can one of the Bureau members walk us through the changes of the proposed bylaws?
Shelley, do you by any chance have the version that we had with changes noted on it? Sorry to ask you kind of mid-meeting to project that. I think this is the updated version. I don't know.
The attachment has the updated. There's nothing really for the bylaws part, but for the roster roles there was.
Okay, so the main change was just to the roster roles, is that correct?
That's correct.
Okay. So Josh, I think the part that we're trying to update a little bit is actually more the roster, which is part of the bylaws. The bylaws actually are not changing for the standing committee meetings as much as they were for the statutory meetings. But you can see highlighted here that Shelley has shown on the screen kind of some of the updates we're trying to make. Part of this was really trying to find a way to kind of make sure that all the regions were equally represented. We had some kind of areas where we had two regions competing in a sense for the same position, and so we wanted to make sure that just each region had one position, and then just making some of the other pieces a little bit more clear on the agenda.
Thank you very much. I think everybody can see on the screen, and you can pull up the attachment then of the track changes version of the bylaws. Any discussion about this before we call for a vote to approve the changes? Simply for discussion purposes, I did have one question that came up to me when I looked at this. The term pre-hospital EMS coordinator is used multiple times, and we have great representation. I wondered if that is pre-hospital and EMS is the same term. So I was wondering if we needed to clarify that, simplify it. We clearly know the two individuals who are our representatives currently and do a great job. I just wondered if we needed to clarify those terms.
Josh, that's a great point. I think depending on the hospital system, they tend to use different terms. What would you think about potentially using pre-hospital / EMS? Or do you think that's still redundant?
I'm certainly very comfortable leaving that as is, purely again for discussion. I think if people use the terms interchangeably, that would be great. Any other questions or comments before we call for a vote on this? Okay, I'd like to call for a vote then to approve the TEPI bylaws with the recommended changes as written. All those in favor to approve the bylaws, say aye.
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 Thank you. All those opposed, say nay. Okay, hearing none opposed, the motion carries and we will approve the updates and changes to the TEPI bylaws. Let's then move on to discuss, amend, and approve validation scores for proposed PEEP data standards. Can I have a motion to discuss this topic?
Rebecca makes a motion to discuss.
Okay. A second?
Second.
Thank you.
Second for Michelle Gladmiller.
Thank you, Michelle. Bill, are you going to lead this discussion?
Yeah. Yeah, thank you. So just as a quick kind of catch up, at EMS Council 3 months ago, we briefly presented and discussed the fact that the Cactus program had some pretty significant barriers, and EMS Council voted to change the Cactus program with the caveat that we would present some alternatives. So this is the beginning of that discussion, and we're going to present the alternative we think will work. You know, very broadly, we had kind of created our own logic to try and identify data completeness when we think that that kind of already exists for most EPCRs in the form of a validation score. So what we did was we, Julia, I'm going to present my screen again, sorry. We ran a report to, and this is anonymized, so no agency or vendor is identifiable, but we ran a report to see what the validation scores are like across agencies and vendors, and almost all of the agencies are perform extremely well. And so when we talk about a PEEP standard that for premier EMS agencies and using the validation score to set a benchmark for those agencies, we feel that the validation score is an appropriate tool to use for the that benchmark setting. The ask for this—
Can you make it a little bit clearer, please?
Yeah.
Thank you.
Better?
Yes, sir. Thank you.
The ask of, and I'm just going to kind of scroll down so you guys can see that most of these are above 90% across all vendors. The ask of this group is we need to establish and I'm sorry, I should clarify, this is median of 1 month of validation scores by agency. The ask of this group is we need to establish a time frame for the score making, and we need to essentially pick a benchmark cutoff. I think that was one of the things that kind of got muddied with the Cactus program was we really, well, maybe we bit off a little more than we can chew. And so I'm hoping that by making this a little simpler, we'll make some forward progress here in terms of picking, you know, this tool and then establishing both a time frame. So we can do shorter than 1 month, and we can do longer than 1 month, potentially a quarter or 6 months. I think my caution with anything longer than a month is one of the problems we ran into with the Cactus program was the feedback wasn't fast enough for agencies to change anything. And so that's kind of how we landed at 1 month. But that is also open for discussion. And then I think the cutoff. So I think based on the fact that most of these median scores are 90% or above, 90 or 95% is not unreasonable for a PEEP agency to achieve based on the fact that a lot of agencies are at 100%. And then the third thing that this group would need to pick would essentially be a go live date. So if we decide to do a month of median scores, pick a benchmark, then determine how much time PEEP agencies will have to correct anything and get to that benchmark score that this group selects. So that could be a year, 6 months, 2 years. So those are kind of the 3 asks of this group as well. So with that, I'll stop talking and turn it back over to Josh and kind of answer questions and any discussion.
Thank you, Ben. So for simplicity's sakes, I would like to take these one question at a time. So can we first, I believe the first question that we need to address is the question of, is everyone comfortable using this as the appropriate benchmark, maybe the wrong word, the appropriate data for PEEP data regarding this tool for data completeness? Hearing no real questions, I believe the second part of this is the actual numerical value. Is that correct, Ben? Which number would we like to identify as a number that would indicate performing agency? Is that correct?
Correct. Yes, correct.
Any discussion regarding what that number should be? I believe the suggestions were 90-ish%. Is that correct?
Yes. So based on the kind of previous performance, I think my recommendation would be 90 or 95%.
Okay. Discussion on what the threshold should be to have for data completeness to be a PEEP agency.
I'm sorry, this is Rebecca. Since we're switching the system, would it maybe be wise to start out with a 90% until everyone is comfortable with it and moving forward? And then as we all get our systems in line, we then raise the bar to 95%.
Thank you, Rebecca. Any other comments or suggestions?
This is Ray Proa. I'm agree with the 90% as a percentage for right now, and then just kind of mirror what Rebecca said too. She was kind of thinking the same thing I was.
Thank you, Ray. Any other comments?
This is Garth Gamer. I concur with Rebecca.
I apologize. It may have been my internet. Was someone trying to make a comment? If so, I could not hear them.
Dr. Gamer supported the 90%.
Thank you. Okay, any other discussion on that topic before we move to question number 3? Okay, moving to the third question then, which is the date at which you would like to start reporting. And I believe this is in some ways a question if I'm wrong. The date at which we would like to start reporting this to agencies and the date at which we would like it to become effective. Is that correct?
That is correct.
So before we move on to comments, one question about this for the Bureau. You have that you wanted to, my question would be, how far back does the data go?
You broke up a little bit there, but I think the question was how far back does the data go? So I think the intent here is if we use a month of data, the median score for a month, and we selected an implementation date, that would give people essentially 6 months or a year or whatever time frame for those monthly median scores to meet that benchmark. So conceivably, they, I think I understand a little bit more. Do they need like a year of meeting this benchmark, or do they need a certain time frame of meeting this benchmark? Is that sort of the question, Josh?
I think yes. I think you answered it. The question you answered the question. So I think we're. Okay. I think that answers my question. Comments or thoughts about when we should start reporting this and when we would recommend that this essentially become effective.
This is Rebecca. I would like to say in my eagerness that we would start this right away, but being realistic with the approaching holidays, with new people in new positions, perhaps this is something we do a January start date, let it run 6 months, and if we're not finding insurmountable obstacles with our agencies, then it becomes official June or July 1. Just a suggestion.
Thank you, Rebecca. Other suggestions?
Rebecca and Josh, this is Gail. And just to clarify, so the ask from the Bureau is for TEPI to vote and make a recommendation to EMS Council, and EMS Council would be the body that would then officially approve or not approve this as the standard for PEEP recognition. So that meeting with EMS Council is in January. So really the ask for this group is to kind of come up with a score, a frequency with how often that report will be provided, and then also is there a time frame that if an agency fell below a certain standard that they would have to kind of correct their standard before they lost their PEEP recognition status. So hopefully that clarifies it a bit.
Oh, that helped. Really, thank you, Gail. Appreciate it. Disregard what I said.
Yes, thank you, Dr. Bradley. So with that clarification, any other thoughts on what we should recommend to the staff committees?
Dr. Gaither, I would just say that I think this is a great way to go about this and help with the Premier EMS Agency program. I like how this is being addressed. It looks like it's creating a more equal playing field for everyone, regardless of what vendor they use. And that's really paramount for agencies to be successful. So I am good with the desires of the group. I'm not sure if we need to present something to EMS Council in January. That would be a Bureau question, but I like where this is going. Thank you.
There's a question.
My apologies. I had to switch computers.
That's okay. There's a question in the chat box from Matt Shaw about whether or not this is an apples to apples comparison. So it won't matter about which vendor you use or per agency. So the way this functionally works is it gets screened against the same XML schema that is validation rules. So they are available on our website if you want to see what the validation rules actually look like. But regardless of vendor, the vendors are supposed to comply with our state validation rules and then national data rules. So yes, it would be consistent across agencies and vendors, regardless of EPCR system. Does that add? Okay, thanks.
So this is Gail. I think Ben is projecting right now, and I think this is a really nice visual of kind of how we get the data in AZ peers. So when you look at the NEMSIS data set, so kind of what's required at the national level, and you look at AZ peers, you can see that we actually require a much smaller number of data elements compared to the national standard. So I think this is a nice visual depiction of that. This was something that Anne and Julia just put together, and I think it's a really helpful visual to hopefully help agencies kind of recognize when we talk about AZ peers, hopefully that they recognize we're not kind of making a very high benchmark compared to other parts of the country.
Any other questions I can answer?
Jim Cessalini. I want to bring up a detail of, as far as the law enforcement part of this is concerned, because when we do our PCRs and we're using the image trend, when my EMS guys that are law enforcement are completing their PCRs, we're meeting our benchmarks pretty good. The problem is that same PCR program is also being used on patient care report for the opioid side, which is law enforcement only. And that's where we're seeing a drop down in our validations. So we can fix those, but it does take us time to go back into the system and figure out where the errors are occurring, because we're getting the law enforcement opioid use being mixed in with the PCRs, which is causing us data validation issues.
I'm going to let Anne address this, but I'll let Anne speak to this.
So, which agency are you with? I don't know.
Maricopa County.
Okay, so you're a law enforcement agency that also has EMTs, which we have a few of those that are kind of not hybrids, but so anything that you enter in your EPCR that is done by your EMTs should be meeting the standard because you're providing patient care. If you're also having your officers enter directly in when there is no EMT care, and you're entering those in, you're right, those aren't really meant to be run through that program. We can definitely address that, and you and I could meet separately. And if there's any other agencies that are sheriff's departments or police agencies that are doing that, for DPS, for example, I set them up as a separate agency versus their air rescue, which is EMTs and paramedics, versus their first responder units that are the troopers, so that they can report that separately. So we can find a way to make sure that doesn't affect you.
Thanks, Anne.
Okay. Any other questions, comments?
This is Rebecca. I'm sorry. I just wanted to say thank you to everyone for their work on this. This is really, really good. And the efforts are much appreciated.
Yes, agree. So I'd like to summarize and then ask for a motion or more discussion specific to the summary. So just to summarize, I think where we are at is that we'd like to recommend that 90% be used as the threshold to maintain PEEP status, that the reporting frequency, I think we have not quite landed on how frequent to report, but I would recommend quarterly at the minimum. And then the remaining question would be, how long does an agency have to improve their data completeness before they lose their PEEP status? I think my recommended starting place would perhaps be a year. So with that background, 90% quarterly reporting and a year to improve status before leaving PEEP. can we have some more discussion on those specifics?
This is Ray Proa. I agree with Doctor there on the 1 year, just because, and Ann probably could correct me if I'm wrong here, is while most of the vendors do the changes to make sure everything's current, there are some vendors that they require the agency to actually change and input the data themselves. And with everything going on, minus COVID and everything else, I think 6 months would be good, but I think the year would be a safe bet.
Thank you. Any other comments? This is certainly a new and different way to look at things. So I'm open to more discussion on this.
Dr. Gaither, this is Amber Prince. I agree with the quarterly output of information just for the fact of being able to identify trends, or if there is something else different going on, such as COVID right now, that could be affecting things. So I do agree with the quarterly and then the year to maintain.
Candace seconds.
Thank you, Candace. Just to formalize this, I think we do need a formal motion that is not from me. So I think the consensus, just to restate, is 90% threshold, quarterly reporting, and annually annual requirements to meet that. It does appear that the Bureau could provide agencies that information on a monthly basis if the agency is interested. So can I have a motion to reflect that?
This is Amber Prince. I'll make a motion.
Thank you, Amber. And Candace, I will take that as the second if you're okay with that.
I am fine with that. Thank you.
Thank you. I'd like to ask for a vote on this motion. All those in favor of recommending these thresholds and reporting frequencies, say aye.
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 Aye. Aye.
All those opposed, say nay. Hearing none opposed, the motion passes. Thank you very much to all of the Bureau staff for the work on this. I know this has been an incredibly labor-intensive process. Thank you all. Having made it through that agenda item, the last agenda item is to discuss the sequence of discretionary reports. If those of you who are online want to click to the TEPI list of potential topics for discretionary reports, I'm certainly happy to rearrange the recommended order or add to this if there are any suggestions. Okay. Hearing none, I would think we will leave this as is. Returning to our agenda, that ends the discussion and action items. Let's turn to our updates. Does the Trauma Registry user group, Melissa, do you have any updates for our group?
Melissa was not able to attend today. She did email me that she has nothing to report other than for everyone to review your 2021 data dictionary. And that's all.
Thank you. Turning then to the Trauma Program Manager workshops, Heather.
This is Kara Mitchell. I can speak for the Trauma Program Manager workshop if Heather's not on.
Can you? Yeah, I'm here. Can you hear me, Kara?
Oh, yep, you're good.
Sorry, muting too many times on my phone apparently. So we had our Trauma Program Managers workshop virtual, and Kara, add anything if I miss it, on October 23rd, 2020. There was lots of good discussion about trauma registry and the AZ Peers connections, and the EPIC data. We also talked about, Sean did a little bit of research on referring scene calls and transport of blood and how that looks in interfacility transports. But obviously we don't have blood in the field currently, so there's just a lot of discussion on how that process and procedure looked. And other than that, I don't think there's too much more with that. Did I miss anything, Kara?
Nope. The only other thing I had listed was the moving in our registry from the state from our current AIS to the new AIS system, and whether or not that was actually a go live in January.
Okay. Yeah, and I do know the Arizona Trauma Association put out a big class for those facilities that need the AIS training for the next couple months.
Okay, thank you both for the updates. Next then, let's move on to EMS registry user groups. Ray, do you have an update for us?
Yes, sure do, Doc. The EMS registry group user group met on October 26th. There was actually it was a pretty long meeting, and it had quite a bit of things that went over. So first thing was Ben and Ann covered the Cactus data set update, and basically with how the current data state is they're moving away from it due to technical difficulties, and being only able to run that report every 6 months, and to give the users more of a quicker up to date, and so they can do monthly changes. They also covered just basically how we're doing it, look for an alternative method for the PAP or PEEP status to make, like I said, make it quicker. The 2020 annual report highlights for Gibbon Mashri. They basically went over how covering the EMS AZ Peers data from EMS. Basically 90% of the data is 911 calls, 8% IFTs, and 2% were other. And also did cover the covered data imports for making sure we've been getting, especially the PEEP agency has been getting the new unsuccessful reports every month or every quarter with the corrections, so that the agencies know how many they had, and they can try to re-import them to make sure they stay current. Like I said, that's being sent out quarterly. And if you can, all the agencies, if you get those, please try to resubmit. And that's kind of one of the things I kind of mentioned earlier was a lot of the actual vendors will make the changes, such as updating stuff. So the agencies don't have to do it, but there is some vendors, I believe, correct me if I'm wrong, this one, and that Zoll's one of them, where the actual agency has to go in there and actually manually key in and put in those changes. They don't do it for, the vendor doesn't do it for the agency. So that can take a bit of time depending on how off you are in your data. So the NEMSIS update. So right now, Arizona is currently sending data in 3.4. There is the new version coming, which I believe is 3.5. It's considered a minor update, not major, but you know, until it actually gets done. At this time, the goal for NEMSIS is to have everybody reporting in 3.5 in January 1st of 2023. I believe the Ann and the registry is trying to kind of monitor it, because I guess that date has been moved out already. So, but right now, if they require January 1st, 2023, I believe the goal would be to November 1st, 2022. So there's still a little bit of time. And like I said, everything is kind of with COVID moving back. So they're just kind of watching it. But for the most part, everybody's reporting in 3.4 as it is now. The other update was make sure that your agency contact to receive the reports is current. One of the issues they run into a lot is they're sending out these reports and the person has either moved on or retired or no longer works there, or it's just not current. And then people aren't getting these reports which Ann shoots them out very often. It seems like I'm always seeing them. So it's really helpful to stay on top of stuff. The updated destinations data set was sent out, I believe, a week or two ago. So everyone should have received that, to make sure if you have any destinations that aren't listed, and make sure to update that every other month, or when it comes along, so she can give, if for some reason one of your it seems like for me in my area, the behavioral agencies seem to be, especially out of state and or not out of state, but new agencies kind of pop up for the behavioral. And if you need a number, make sure you get her the address, make sure you get her some information to go with that so she can add that into the set. The other thing that was covered was ET3. Looked on the ET3 website, and there's actually, I believe, like 8 to 9 participants in Arizona. One of the ones they're going to have to work, this is one of the things that they're actually going to have to kind of work with to be a little dynamic. And the reason why is the pilot program is getting ready to start on the 1st. We do have a couple people I'm familiar with that are taking part in it. Surprise Fire with Chief Rivera. I believe Maricopa County Ambulance, Peoria Fire, Mesa Fire are some of the other ones that are 8 agencies that were listed on the CMN website. But that data that's submitted there is actually, I guess, its own separate data. So they're kind of have to figure out an AZ Peers a workaround to kind of see how that's going to work. So the other thing is there were some questions as far as the HIE, Health Information Exchange, and the trauma registry linkage. And I believe that's been put on the back burner just because money and then the differences in the data that each requires and stuff like that. And if I had to leave, I believe that was like the last item on the agenda for that for the EMS Reg for You. So if there's anything else I missed, if Ann could just chime in, but I think I got pretty much everything.
No, that sounds great, Ray. Thank you.
All right, thank you very much. That is the last item on our agenda. If I could call for any agenda items to be considered at the next meeting, feel free to put those in the chat or speak up briefly. Any agenda items? Okay. Finally, let's do a call to the public.
Dr. Gaither, this is Ben. I'll just make one kind of quick announcement, just that that infographic I displayed earlier, we are working on a couple more of those that we'll have on our website in the AZ Peers section here pretty shortly that hopefully will help explain some of our programs a little bit better. So keep an eye out for those, and hopefully we'll have them up here later this month.
Excellent. All right, upcoming events, please do visit the Bureau's news and conference page and training program page, as you can see listed there on the agenda. And with that, our next meeting will be March 18th. And can I have a motion to adjourn?
Candace Williams so moves.
Ray Pro, second.
Thank you all. With that, we'll adjourn the meeting and we'll see you all in March. Thank you.
Stay safe, everyone.